there's an important aspect of understanding what the implications of clinical data are that you might not understand if you haven't been a clinician, if you haven't kind of been in the room or tried to take assessment data and translate that into some kind of treatment plan. On the other side, if you've never really dealt with data or statistical analyses or research, you may be measuring things in ways that don't actually answer the questions that you want to answer. You might be choosing variables that don't actually get at what you're trying to do.
Welcome to Meeting of the Minds. I'm Chris Hemphill from Wobot Health. And for the folks that are new here, first Meeting of the Mind session, we focused on issues like health equity, AI in healthcare, and many, many other topics. You can find them on our YouTube if you search Meeting of the Minds Wobot. But ultimately, we're just glad to have you in another conversation. Something that we've actually seen a lot of attention around this subject. We're going to be focusing on breaking past the hype that we see in digital health. So I'm joined today by Dr. Quyen Ngo, who is from Hazelden Betty Ford, and we're going to be discussing how to break past the hype with digital health. And just a little frame up and just a little background there is that there are over 55,000 digital health applications. You can look it up on Statista, 55,000, that's a real number, and they all purport to be the solution for things like remote monitoring, mental health, consumer experience, and a myriad of other subjects. So there's a great deal of hype out there, but there's also a great deal of solutions that can help with improving experience and outcomes. So the big question is, how do we know what's going to work, and how do we know what's going to be leading into the next Watson or Theranos? I know you're all thinking, Chris, you work for Wobot, you work for a digital health company, so why should we even be here listening to you? Well, you don't have to take my word for it. Allow me to introduce Dr. Quyen Ngo. Dr. Quyen leads digital health research initiatives that suss out which applications are a good fit for the Hazelden Betty Ford Foundation. Hazelden Betty Ford focuses on treatment and research for substance use and mental health. So that this is a perfect walking of the line between mental health and digital health, if that's what we're here for. She's the executive director for their Butler Center of Research, and she has a deep research background in clinical psychology, substance use disorder, intimate partner violence, and digital health interventions. So straddling that line, digital health and mental health, we're delving in to how to know which solutions are effective, equitable, and ethical. So kicking us off, Dr. Quyen, what are you excited for our viewers to learn or change?
Well, I'm, first of all, really looking forward to this conversation. So thanks for having me on, Chris. And I think that, the conversation today will really be about, how do we do the best for our patients and for the people we serve, right? So I think it'll be important to walk away with this sense of, one, that, research doesn't mean that, everything's going to move so slowly that you can't be competitive or you can't get things done. But you can do things in a responsible way, in a scientifically sound way that both helps business and healthcare move forward. And I think that also our conversation around just, how do you choose? There's so many things out there, like you said, so many things to choose from. And people come in with their slides and it looks fancy and it looks great. How do you know it's the right thing for your organization and for your customers or your patients?
So that's a fantastic frame up, Quyen, about research not being the blocker there, that it doesn't have to slow everything down to where business can't be done. There was actually a previous guest, and you probably, if you saw the trailer to this event, then you saw this term, pracademic.
Mm-hmm. Yep.
Which, yeah, so taking the concepts like the important research founding of academia, but also the practical nature and the need to execute in the business world, and finding that line and marrying between those two. So excited for the way that you frame that up. As a reminder, we're doing this live. It's not pre-recorded. thoughts, questions, share those. We want to hear from you. And if something resonates, shout it out and share it with the rest of the chat. Thank you, Quyen, for just framing up what you're excited for people to learn about today. And when we're going over your background, going over like where you are with leading research at Hazelden Betty Ford, I'm just curious about like what's your day-to-day, what are you doing today in digital health, and what's, just taking a step back, what's motivated you down the path that you've taken?
Sure. So today I lead a team, as you said, at the Butler Center for Research. And so we are the research arm of the Hazelden Betty Ford Foundation, which is an addiction treatment health system. And so as part of what we do, we run clinical trials. So we have clinical trials that happen within our health system. We also, that can include, everything from kind of bench sciencey, like how are our cells working in response to certain things, as well as behavioral. So we have clinical trials that happen. We also do outcomes data collection for our organization. We look at the data that we collect. I work closely with the clinical team in terms of, how do we collect good clinical data, and how do we use that so that we can continue to refine what we do so that we're doing the best for our patients. And I really love what I do. I came from academia, so I like to say that I'm a recovering academic. And I've spent most of my life in academia, but I came to the Hazelden Betty Ford Foundation and I've just really loved the practical side of this, and also being able to engage in lots of different kinds of research. So part of what brought me to Hazelden Betty Ford is really the fact that I'm a clinician by training, and as much as I loved academia, and there's an incredibly important role for academia, I really wanted to have a more direct impact on patient care. I wanted to see more that translational aspect of research to practice, and so this position has really allowed me to do that, to really engage and build a team that is taking those principles of research and science into patient care.
So that's an exciting way to frame it up too. Just the idea that there's this heavy background in research, and you were looking at like somehow this opportunity to to take that research and have an impact is what got you started down this path.
Yeah, absolutely, absolutely. And I think that so often we think, research is often this ivory tower, and a lot of research isn't seen by, people outside of academia. And so I really wanted my career to have an impact in, taking that science, taking that research, and applying it in real world settings. Companies and treatment centers, they don't have the luxury of, getting a grant and running a randomized controlled trial in a very controlled way, right? Like companies and healthcare settings, we have to think about keeping the doors open. We have to think about, all of the, regulations that come along, especially in addiction treatment, with, caring for our patients. And that's a really different setting. And not that there aren't regulations in academia. I just want to be clear that human subjects research has a lot of regulations, but in here, where I am now, it's really an intersection of that research and also patient care. And I think that my team and I have really filled this niche that's been missing, which is that, we are clinician researchers. So having someone who has that sort of clinical hat, but also the research hat, is something that, my team has done really well. And I love my team and I'm really proud of them. So that has been a really nice intersection that I've been able to bring to our center and to Hazelden Betty Ford.
Well, I like that perspective. And I like the fact that you talk about that intersection between clinician, researcher, and now in the more practical setting, because I think that the folks in our audience, like they're like, I'm personally not a clinician, with not a research background and things like that, but there are decisions that every one of us are in charge of, and every one of us has to permeate through our digital health companies or our health tech companies. So I think what's exciting about this conversation is being able to extract some of that knowledge, extract some of those principles that we can start applying out in the field. So actually, John Crumpton just threw out a question about what variables are important for collecting in behavioral health in reporting via Self App, and it's related to where I wanted to get started too. What are the key things? What are some key principles that they should be looking for and thinking about before engaging these digital health vendors?
Yeah, that's a great question. One thing to know or note is as you're evaluating, these different vendors, you want to, the research, so this is my research hat on, right? You want to know that whatever you're getting is working and doing what it says it's going to do. Right. And to be able to determine that, there needs to be some good studies or at least some piloting that's happened to give you that data. Now, what I've seen happen is, some vendors will come in and they'll have this slick slide deck. And then they might hand you, 100-page PDF or Word document that's filled with research. The difference is that it's not research necessarily on their platform or their intervention or what they're doing, right? It's kind of a summary of the research literature, right? And so you look at it and you're like, I'm not reading this 100-page, summary of a research field. But it looks good, right? There's the research there. And so it must work. Right. And so that's one strategy that I've seen people use. And so what's important then is to look specifically and see, have there been actual studies done, and it doesn't have to be a randomized controlled trial, right? You just need something there to show that like they've tried, they've been thinking about this. They've really been thinking about how do you gather this data to show that what I'm doing works. And so that, I think that is one of the most critical pieces is, have they been thinking about how you measure this, right? And if someone has a good sense of research, if they have collected the correct data to answer the question they have, right? So the question is, does my platform work, right? A lot of times people come with, people really like my platform, right? Which is a different answer than does your platform work? And so, it needs to be more than just kind of someone's happy with it. Someone would recommend it, right? That's great, right? And that does give you information in terms of will people use the platform, right? And you do want to know that. But you need to, take a step beyond that and say, okay, well, they'll use it, but is it going to help them? Is it going to make things worse? Some things have made things worse, right? So it's really asking some of those questions and knowing behind that, what is there really behind to show that this platform is actually going to work.
That's a really good. The way that you frame that up is let me make sure I understand it right. But imagine you've seen the slick PowerPoint. And now you're asking for the research, and you get a tome of information and studies and things like that. But there's no guarantee necessarily. Like it's taking a step beyond just the fact that the studies are there and the abstracts are there, and looking for details that suss out whether or not this was actually tested on a population, and what some of those results were. Not requiring them to go through full like multi-arm trials and things like that, but at the very least, was this tested?
Yeah, that's exactly right. And it's really not enough for a platform to be based on good research, right? So you can have a platform that uses, I don't know, cognitive behavioral therapy, contingency management, because those are well researched in the literature. There's good evidence that they're effective. But that doesn't mean that the way you're doing contingency management or CBT is effective, right? So you actually have to have the data on what you are doing in order to show that efficacy, because it doesn't matter if, Susie Q out there at university, of whatever, showed that her contingency management and CBT program worked. You're not necessarily doing what she did, right? You have to show that what you have based on her work also works. And so that's also something that happens, that I've seen happen, is vendors will come in and say, this is evidence-based. This approach is evidence-based. Well, that implies that they did the work there. That implies that they did the research and they have the data to back that up. But a lot of times what I've seen is, no, they don't actually have the data on their intervention, but they can tell you about studies on someone else's intervention that uses the same principles, right? It's different, and it matters because you don't know if they're doing the same things the same way as this other intervention that was shown to be effective. So there could be things that are different about what they're doing that could make their platform or their tool ineffective. You don't know that.
So that's a great way to look at it, is that there's lots of great research out there. There's lots of great studies that have been conducted on these populations. But if the application, if the applied manner, if you're taking that research and applying it in a way that doesn't work, it doesn't matter that they were able to rattle off those acronyms that are associated with those great things that have happened. It has to be based on, do they have the data to back it up, and like have they run their own trials or put it on their own scenarios?
That's exactly right. And it also matters, who was included in the research to begin with, right? So if an approach has only been researched in one population, and then someone takes it, picks it up, and puts it in for another population. And this happens a lot with marginalized communities, right? Like they'll take one intervention and they'll just kind of apply it to another community. And the work hasn't been done to adapt that or to show that it's effective in that community. So, you have no idea whether or not it's going to work, from adults to adolescents, or from, this community to that community. You really need to understand within your patient population or within your customers, does it work for them?
More great principles to hold a vendor accountable, or hold another body accountable. If they're saying that, I'm just going to throw out a number. If they're saying that this was 99% effective, like I like throwing out 99%, because it's like whenever like we're
Nothing
doing
is ever 99% effective. Just
yeah, starting out there. Yeah. So starting there, and then if they can't even answer the basic question on which audience, on which population, then there's a whole lot of people that are aggregated up to that layer that you're missing out on. If I'm always thinking about it in terms of data science models. So that's why, yeah. So, but either way, those really pretty high end numbers sometimes fail when you go deeper on, well, how did it do on this segment of the population? How did it perform on women versus men? Or right. Yeah. Yep.
That's exactly right. That's exactly right. Now, those are great opportunities to partner with vendors, right? And say, hey, I don't know that it's effective with my people, but maybe we can collect some data and see, one, do people like it, and then two, is it working for them? Is it helping them?
So digging deeper in that, like I've realized that we're going back and forth on like these general principles, and I think I hope people have been taking notes. There's some really good stuff to go off of here. But I was thinking about, what if we delve into some examples where we're thinking through these principles, and you've been evaluating the like various projects for Hazelden Betty Ford, and you found something that worked, you found something that was successful. Could you talk about what that intervention was and what the vetting process was?
Yeah, absolutely. So I can share one of the clinical trials that we have going on right now at Hazelden Betty Ford in partnership with Spark Biomedical. So, hey, Spark people. But this is a device that is kind of like a TENS machine, those muscle stimulation kind of buzzes when you put on little patches, but it's called a transauricular neurostimulation system or device. And it's basically kind of like a sticker or something that sits behind your ear and has a piece that kind of comes right on the outside of your ear here. And it stimulates specific nerves. This device is FDA approved. So one, it's already been through that evaluation, right? And then two, it has some preliminary evidence already showing that it's effective in reducing withdrawal symptoms for opioid use disorders, right? So it's got some pilot data there. In addition to that, when we met with Spark Biomedical, they also provided sort of the theory behind why they had this device, right? So the theory is important. Is it theory driven? For me as a researcher, as a clinician, you may not care. Well, you might care, but as a researcher, is it theoretically and scientifically sound? So the principles you built that device off of, does it make sense? I read through the research, made sense to me. Looked at the preliminary data, there was support for that. It was FDA approved. We talked through a lot of that. And then the second part of that, after all of that evaluation, is it something that our patients need, right? So we have patients that when they go through withdrawal or when they're detoxing, they don't necessarily want to be on medication for addiction treatment. But that's currently, the best practice that we have for our patients. It's effective. There's a lot of good research behind it, but not all patients want it. And so if we can offer someone a non-medication alternative, will it help them in their recovery? Will it help them, in their addiction treatment? And so is it, something that could potentially benefit our patients? Absolutely, right? And it's a need, and it's something that our patients have communicated to us. So, there's a desire there. And then, are our staff on board? Do our staff also feel like this is an important product? That could help within our system, and our staff were on board as well. So it's sort of the scientific vetting, the efficacy or preliminary efficacy vetting, the safety vetting of that, and then also confirming with our patients and with our staff that it's something that's needed and wanted, right? The third piece of this is safety around the device and the study. So when we do human subjects research, which is any research that includes people, basically, there's some nuance into that, but we don't need to dive into that here. But I want to make sure that what we're doing is safe for our patients. So we're not doing super experimental things on our patients, right? We're doing things that, are grounded and have good evidence to them. And we need to make sure that our partners are following all of the rules, laws, and regulations, both for clinical research as well as for patient care. So there are lots of regulations from the Department of Health and Human Services in the US when you provide addiction treatment. And that's on the treatment side, that's the clinical side. So we want to make sure that our partners respect that. But also when you're doing research, there are lots of regulations around human subjects and making sure that they're safe, that we are protecting privacy, that we have anonymity there. And so we want to make sure our partners are following that as well. So when you're doing clinical research, you have to be on board with all of that. And so when we brought in this device, we had to go through all of those levels of evaluation and vetting and talking across our various departments to make sure that this made sense for us as an organization.
So that brings a lot of things to bear, because what on the one hand, there is the efficacy component, the question of, does your product do what it claims to do? But in your frame up of all the things you need to evaluate, just because the product works doesn't necessarily mean it's going to be working for your organization. So it sounded like you're bringing in not just the research on the product itself, but also the understanding of how your culture might receive the intervention and how teams might be impacted and work with it.
Yeah, absolutely. And that's kind of basic change management, right? You need buy-in from people. They need to believe in what you're doing, and they need to want to do it as well. And if the organization is very much against it, then there's work to be done there and decisions to be made. But absolutely, it's working across teams, it's evaluating, just because something is fancy doesn't mean that you should be bringing it in just to look fancy. If it's not actually going to be helpful, or you can't actually implement it as an organization, then that's a waste of resources, right? And we need to be responsible stewards of the resources that we have. Everybody's talking about how there's not enough people, there's not enough time, there's not enough money, right? So if you're throwing resources into something that doesn't make sense for your organization, it doesn't matter how fancy it is, and it doesn't matter if it's effective.
You've addressed the issue of people saying, "Hey, my product's effective. This is it's ready to go," and also the issue of people saying, "Well, people like using this product and all that," but it's still that's data that's coming from the from the vendor. So we got a question from Michelle Guerra in the audience. To what level would you trust the digital company's own analysis that's speaking to their effectiveness and outcomes versus independent analysis of their digital tool?
So, independent analysis is always, preferable, usually. Usually. But I think if it's an internal analysis from the organization, I need to know what they did. So I want to see what kind of data they collected. I want to see when they collected it, who collected it, with whom it was collected. So who did you ask, right? Did you cherry pick the people that were like, I love this thing, right? And so you're like, great, can you answer this survey, right? That doesn't actually tell you, whether or not it's effective. It tells you that the people who liked it felt like it was effective, right? So I want to know, I want to look under the hood of that research and see what they did. Then I want to know how much missing data there was, because if there's data missing, if there's data missing, there's all sorts of, skewness and bias that can be introduced into the analysis. So that's where it's really important to have a researcher, preferably who's also at least familiar with clinical work, who can look at the data and say, well, did they just filter out this program because it didn't have, good results? Did they just leave this variable out because it didn't say what they wanted it to say? You have to really dig into that research a little and see what exactly they did.
I think that anybody listening should be able to take note to the types of things that they should be focusing on. But also, if we flip it, we're talking about focusing on from like an evaluation or purchasing perspective, but flipping it to the product designers and digital health vendors out there. We got a question from someone else in the audience about what kinds of considerations they might want to make with their design decisions, and what are some of the things that they should be focusing on to make sure that not just they're positioning themselves well for whatever evaluation, but they're doing right for their audience, because there's lots of scenarios where there might not be that expertise within the organization right off the bat. So I think that's kind of where that question might be coming from.
Yeah, absolutely. So two pitfalls that I see vendors falling into. One is they haven't spoken to enough providers. So, and it's not good enough to reach out to your friend who is in this industry and provide services, right? You need to talk to a lot of different providers and a lot of different types of organizations, different size organizations. Hazelden Betty Ford is a multi-site, large treatment system. There are some smaller treatment systems that function operationally really differently. Right. There are also different kinds of providers. We have, specific therapeutic approaches we have. Other organizations may use different kinds of therapeutic approaches. So you need to talk to a broad, you need to have a pretty broad sample when you're talking about building a tool for someone. And a lot of times I see one of two things happen. One is, someone who is really passionate and excited kind of builds what's in their mind. Right. And they kind of think, this is the way to go. This is everyone's going to love this. Right. But there hasn't been enough, kind of talking to people who are actually boots on the ground doing the work. So that's, that's something that I've seen. The other thing I've seen is you go in with having just spoken to like one person who might be really smart and have really great insights, but then they work in a really specific, system. They work in a really specific way, and it doesn't work for everybody. And then you have to do all of this customization to integrate other, other organizations. So that's one thing. The second thing, when you're talking health and behavioral health, is do not ignore compliance and security. Because the other pitfall I've seen is, vendors coming in who have a really great product, right? But it doesn't actually meet the data security and compliance needs that organizations are required to have, right? And then there's frustration there because, well, what do you mean you need this? Or what do you mean you need that? And, the providers are like, yes, we are legally obligated to this. We have to meet these regulations. And so really understanding and knowing what regulations are required, and it's different by state. So you have the federal regulations and then you have by state. So understanding and knowing what is required of providers in that industry is critical.
So like you're leading into these things that maybe a vendor got some people excited, maybe even got some resources dedicated to like launching a pilot or pushing something on down the road, hopefully not past the point of no return. Because this brings up the one of the very first points that you brought up is that the research arm shouldn't be like just a big blocker in the whole process. But clearly, there are times when perhaps something's not up to snuff from a regulatory perspective, or your research finds that their effectiveness or certain claims they were making didn't all the way add up. So that leads to organizational tension, right? There's people that like the project is their baby and they want it to go through. How do you have that conversation? How do you navigate having to say no to things that people are excited about?
Yeah, well, in our organization and at Butler Center, we use an implementation science approach. And so implementation science is a whole field of study for that sort of translation. How do you take something that is theoretical and may have efficacy behind, evidence of efficacy behind it, and then take it out of the ideal research environment that it was developed in and put it into the real world when you have to deal with, staffing and budgets and compliance and regulations. And so, the whole point of implementation science is how do you translate these things into the real world, into a real space? So it's agile, it's adaptive, and it's really about, okay, so we might start with, here's the gold star. If we were in an academic research study, this is, what we would want to do. And so let's start there, but then what do we need to modify so that it makes sense in this setting? So implementation science is, something that I think is really critical to understand. And it's a really wonderful tool to apply to industry. So that's one thing, is it's not a rigid, necessarily RCT context. But then the other piece of this is, just because a tool isn't meant for treatment of our patients doesn't mean that it's not usable in our system, right? So maybe there's a platform that, has a piece of it that our organization needs, right? Like maybe they have a payment system on there that, an e-payment system that, would smooth things out for us or make things easier, right? That's something that we could use, has nothing to do with, a need for, efficacy in treatment of our patients, but there's a tool there that could be applicable. Maybe it's not that it's going to be used for our patients, but maybe it has a wealth of information that our clinicians could use and apply therapeutically, right? So it's just, it's not just, this is the only way it can be used, but you have to think creatively and strategically within your organization. Like if someone really loves it, okay, is there anything in there that would actually be beneficial, right? And this especially applies if it's someone, who's, higher up in the hierarchy in your organization that like really loves a tool, right? Those can be tricky conversations to have. I luckily have very good working relationships with people above me. So, but when you are talking in that context, it's really about identifying, okay, well, maybe it's not, something that we can use in treatment of our patients, but what other piece would be helpful? How else? Or maybe it's not specifically for our residential program. Maybe we can use it for outpatient. Maybe we can use it for, intensive outpatient, or maybe we can use it for long-term recovery when we're talking about addiction treatment. So there are, ways to think about these tools. And this is where vendors and providers can work closely together to say, okay, well, maybe it doesn't work in this original intent that we had, but what other ways, like how else can we work together, right? And then in that way, both organizations can benefit and both organizations can grow, right? You've got that mutually beneficial interaction there.
Well, that's a really good point, and it respects the expertise that other people brought to the table. There's a reason that they might have been excited about that particular tool or intervention, and rather than it being a big stop sign, it's a question of, well, given our other needs, given other things that we have in our own inventory, what are some other uses that this could be employed to?
And so what can be helpful when you're evaluating tools is talk to a lot of different teams, talk to a lot of different departments, say, hey, this company came in, they showed me this thing and it's interesting. I don't think it would work for this, but what are your thoughts on it? Could you see it playing a role anywhere, that you work in, or any space that's adjacent to you, and so you can kind of socialize it informally, and you come up with some really great ideas that way.
So I think that question is helpful, and it hinges on probably the whole subject of another conversation, but how to make sure that you have those good working relationships with all these other departments so that you have that exchange of information. But one thing that I'm pretty eager to bite down on in here is Julian Mitten asked a question around let's say that you have some interventions in place and you're trying to really understand, how did this affect the patient experience? How did this change someone's perception about, or how do people perceive their use of this tool? Like these things are in place now, and the big question is, like, are we focused on just satisfaction surveys, or are there other types of analysis that you're doing to make sure to like after the fact, after the intervention's been put in place, to understand how it's impacted that patient experience?
Yeah, absolutely. It's, that I think is a question for a lot of organizations that provide care. And it's never too late to collect that data and take a look at what you're doing, right? If you haven't collected that data already, part of what we do at Butler Center is we actually support organizations to do that, right? So we'll go in, we'll work with an organization, we look at what data they collect from sort of what I say from tip to tail. So from the first point of contact all the way through to the end, where are you collecting data? What data are you collecting? And then we look at that and we say, okay, but what kind of questions are you trying to answer? Are you trying to, negotiate a higher reimbursement rate with your payer? Are you trying to convince family members that they want to be involved? What is the question there? And so then we see if there's a match. Are you collecting what you need to answer those questions? And if you aren't, then we make recommendations about what you're collecting there. So it's really important, if you're looking at your program, to make sure that you're aligning the information you're asking for to the question that you're trying to answer. And the reason is because people now are inundated with all sorts of surveys, all sorts of questions, right? Like everybody's got a link, here, get $5, answer these, 10 questions, or, the little texting questions you might have after you call in for, a customer service, issue. So people are inundated with requests for their information. And so if you're going to ask, make sure that what you're asking counts. So can you use that data for a couple of different purposes? Are you asking questions that will answer, are you asking for data that will answer questions for a couple of different stakeholders? So you can use that data to respond to your payers and to families and to patients, right? You want to make sure that that's streamlined and that it's short. It doesn't have to be a 3-hour assessment of data, right? You want to get in, get out, and make sure that you're being really respectful of people's time. But it's never too late to collect that data and to see, what aspects of your program are working. And to do that, you have to understand for your program, what is your theory behind the mechanism of change, right? So the mechanism of change is the thing that you think your program provides that motivates people to change, right? So what is it about your program that you think will encourage people to change? You have to understand that first before you start collecting your data, because if you don't know why you think your program works, you're not going to be able to answer whether or not your program works, right? So you kind of have to understand that so you can ask the right questions so that you can get the outcomes and so that you can get the data you need to understand the outcomes and refine your programming.
Really, it goes back to a point that you made at the very beginning, which is sometimes the questions that people are asking, do people like this app, isn't answering what the person's actually looking for. Was the app effective, for example? Sometimes a digital health intervention might have questions that like surveys or questions that is asking within the system. Was this helpful? Was this satisfactory? Do you feel better, et cetera? What's been your experience with that data? And are there some hard questions that you ask when you see reporting based on what people are answering in the app experience itself?
Yeah, so I mean, I think that's important data to have, right? So billions of dollars go into app development. And I think at one point, someone quoted some statistic or study to me that, people will use an app on average for 2 weeks, maybe, if you're lucky. Sometimes just like 3 or 4 days. So you got like a few days to convince somebody that they should integrate your app or your tool into their lives, right? And if we think about our lives, they're complicated. We don't, any new thing can throw off an entire, workflow or an entire system that someone's established. So when you're thinking about that data, it is important to know if someone's going to use it, right? Because a lot of times people won't use it anymore. So that data is important, but you can't stop there. The point is, don't just stop there. You also want to know if it's actually going to help them. If it's actually doing what it says it's going to do. So it's not that data is not good or not useful. It's just that shouldn't be the only data you're evaluating something on.
That's a great point. And it also leads into, I think, another question around if the data that you're getting is coming from the app, then keep in mind about things like survivorship bias. If somebody's reporting the app reporting within the app that requires them to still be using the app, so there might be a difference in that population that stayed past that 2-week, 3-week period versus the people that had the initial response. So it starts asking, getting to those questions too.
Yeah, that's exactly right. And those are situations where you want to ask, why did people stop? So that's where, even if people don't maintain their engagement, there's still an important source of information for you if you can get them to answer some questions around, why did you stop? What didn't you like? Why didn't you come to Hazelden Betty Ford for your treatment? Right? What was in it? So it's really important to ask those questions, because that's how you get better. That's how you improve. That's how you continue to refine. Look at the things that didn't work.
Now, speaking of engagement metrics, I have to say I appreciate everybody who stayed with us past 45 minutes. That thank you for staying engaged in this conversation. And I know we could go for much longer on this. There's so many different rabbit holes. I feel like we need to dig deeper down. But we are at time, and the big thing that we want to address, we ask this of every guest, is if you could change one thing about the way healthcare is delivered in this country, what would that be?
Oof. One thing about the way healthcare is delivered. Well, okay, so my pie in the sky would be that access wouldn't be limited by finances, right? That everybody who needed care would get care when they needed it, right? So that's kind of pie in the sky. But I think sort of more practically speaking, I think if healthcare was more integrated, so behavioral healthcare with medical healthcare, addiction treatment, having really connected continuity of care from one area to another, so that individuals could be treated as whole people, because all those different things affect people's well-being overall. addiction affects how well people comply with, chronic disease treatments like diabetes and things like that. So it's impactful across different health conditions. And I think more integrated care and really connected care would really help treat people as the whole people that we all are.
Those are two major subjects that I think are getting a lot more attention lately, as we have alternative payment models and integrated care models, whole attention to whole health, integrated behavioral. I could go on. There's a lot of attention being dedicated to those lately.
Yeah, absolutely. And I love seeing that there's more conversation around it. It's important.
Well, hopefully a lot of that conversation leads to action. But again, so much to talk about. I could go on, but I just have to say a big thank you here. I feel like there was a lot of conversation. I definitely learned a lot in this conversation, and appreciate you for joining us on Meeting of the Minds. There was actually people in the chat that were wanting to collaborate and ask questions and things like that. For anybody that wants to reach out, what's the best way they can get in touch with you?
You can email me. You can feel free to reach out. You can call us at the Butler Center for Research, or you can drop me an email.
Fantastic. And for everybody watching, you can keep up with future sessions by signing up for our newsletter, which is at wobothealth.com. As far as this conversation, we went in depth on how to be more certain whether digital health solutions might make sense for your population. But the big question is, as a healthcare leader, how do you act? What are the steps you take to put this into action? We actually had a conversation recently with Dr. Tarun Kapoor, who is the Chief Digital Transformation Officer over at Virtua Health, on his 3-pillar system to digital health innovation. So Tarun provides great advice on taking your organization's culture into account when readying various tech interventions. So again, thank you, everybody, and keep those inboxes open, and we will let you know about the next conversation.